Good afternoon, everyone. I'm Dr. 𝐃𝐫 𝐒𝐚𝐫𝐻 from Singapore, Mount Elizabeth Hospital. I'm also a visiting consultant to Ban Lang Hospital in Myanmar. Today, I'm going to talk to you about the interesting technique of cartilage preservation. Now, what is cartilage? Cartilage is a highly specialized tissue which coats the surface of joints, which allows the joint to glide smoothly. Now, once the cartilage is damaged, it cannot regenerate itself, it cannot grow back. So you need procedures to help the cartilage to regenerate. Now, if you look at it biologically, what does cartilage consist of? It consists of cells, 5%, proteoglycan matrix, and the rest is collagen. Now, what is osteoarthritis? Osteoarthritis is a very common form of arthritis found in the elderly, but it also can happen in young patients who do a lot of sports, who had injuries in the past, and this is very commonly found in the hips, the knees, and the ankle joint. It's a big healthcare problem in Myanmar. Now, what is the magnitude of the problem? It's a huge problem. Throughout, for example, the world, 15 million per year annually develop some form of osteoarthritis in varying degrees of severity. The most common joint to be affected is the knee. So what is the treatment for osteoarthritis of the knee or the hip or the ankle? If you develop this problem, the first step, of course, is medication or injection. But if that doesn't work, usually most surgeons in Myanmar will offer you a knee replacement surgery or revision knee replacement. These are very big operations which a patient tries to avoid. However, there's an age group of 45 to 55 who are not candidates for knee replacement, and these are the patients who will benefit from cartilage regeneration. So before you go to cartilage repair or regeneration, if you are in the 45 to 55 age group, you should try medications, physiotherapy, or different type of knee injections available. If this fail, then you go on to these procedures they call cartilage regeneration. So what are the procedures? I'll run through very briefly. The first one is a �W𝐨𝐶, which means that you take the cartilage from a non-weight bearing area, some plugs, and transfer it to the weight bearing area. We call it �W𝐨𝐶. If you take from here and you put it in a weight bearing area, there's a hole. But however, most studies have found this has not been generally successful, and it wears down in time. The second one is arthroscopic treatment, a very minor procedure where we use a laser or radio frequency to shave the cartilage, but the results are short. After 2 years, pain will come back. You can improve the results, which is what we do here in Ban Lang Hospital, by drilling small holes. We call them microfracture. So this will help to stimulate the bone marrow to bring in cells to get the cartilage to regenerate. And this actually can last for 2 to 8 years, and they are improved by a gel, which also is recently available. You can apply a gel, something like this, onto the surface of the microfracture to heal. So this is what you call the hydrogel. This is after you make the holes, you apply this gel over coat the gel over the surface to get it to heal. Now, the most common technique or popular worldwide is the autologous chondrocyte implantation, which involves 3 steps. Number 1, you harvest the patient's cartilage from a non-weight bearing area of the knee or the hip, and then you send it to the laboratory to make a stem cell or the growth cell, and you need a second operation to put this stem cell back into the cartilage defect, usually in the form of a gel currently. So this is called autologous, the patient-owned chondrocyte. This is supposed to be a good technique. You usually implanted a gel, however it's expensive and involves 2 operations and various steps. So this is the steps. Diagnosis, you harvest the tissue, send to the laboratory for culture, and do a second operation, then send the patient to physiotherapy, and most of them do improve. Now, the other procedure, which is fairly experimental, is trying to grow the cartilage stem cell from the blood, the bone marrow, the fat. This is relatively experimental and not so commonly used. The last technique, which is actually if the knee is crooked, either it's varus or valgus, you can do operations, osteotomies, we see it here. You realign the bone to straighten it so that the cartilage will grow back. So these are the different techniques available. Now, which technique is unique to itself, you discuss with your local orthopedic surgeon in Myanmar as to skill and what is available before you finalize your decision. Thank you.